Big ideas start with a spark. At Tassi's, we use that spark to ignite the fire in ourselves and our kids. So with the trust we build and the knowledge we share, we can grow together and stand tall, creating opportunities to advance in business while setting an example for the next generation. Whether you are starting fresh in Portugal or expanding globally, we're here to support each other. This is more than a network. We are a community that sets the examples for the leaders of tomorrow.
I'm not sure, Keith was saying that the education panel was going to be the best one. I'm not sure about that, but this one is definitely going to be the most beautiful one. And you might be wondering why this AI panel before was full of men and the healthcare one is full of women. Unfortunately, this is a true thing, reality in the true world. Around 70% of the people working in healthcare are women, and 70% of the people working in AI are still men. So we're quite a representative of the reality, and we've got a great panel, very little time, so I'm going to cut it short. And the first thing you think about when you think about healthcare, what is the buzzword that comes to your mind? Any ideas? Oh, yeah. Biohacking. What else? Insurance. That's a good one. I wasn't expecting that one. Longevity. Well done. Exactly. This is the buzzword nowadays with AI, sustainability, longevity. So let's go for it. And we've got here 4 amazing profiles that can guide us through what longevity really is. I think we're going to be a little bit disorganized here. I'd like to start with Joana, maybe giving a general concept of longevity, which is what you do every day. Then maybe going to the digital twin, around pediatrics and how to start early. And then ideally, the nutrition and the mental health perspective. Would that be okay?
Very good. So, welcome everyone. Thank you for listening to us today and this afternoon. What is longevity and why is everybody talking about longevity and living longer, adding years or more life to your years? If you look at the word healthcare, and it says health care, taking care of your health. But actually our system is more developed towards sick care, right? So you are focused mainly on treating disease and rather preventing it. And so even though, of course, it's important development in science with antibiotics, more quality of hygiene, more development of drugs for chronic diseases, we are actually living longer, but not necessarily healthier. The incidence of chronic diseases have raised a lot in the previous decades. And so this means more burden in economy, in social care, in insurance companies, in retirement age. So this makes it think we need to rethink how we're taking care of ourselves and not focusing, of course, we need to focus on disease, but maybe it's better to invest on preventing it. And so longevity is all about that. Longevity is not about increasing your lifespan. We are humans and we are made genetically to die at a certain age, but we want to improve the usefulness, the use span, adding more quality of life to those years we are actually living in. Okay, and when we talk about longevity, we don't just talk about, when you're 40s or 30s and, okay, let's start biohacking ourselves and, we need to start to think about this as a life cycle because longevity starts, Carolina, you would say more than me, it starts in the womb, right? Yeah, we actually start to age in the second week of gestation. So when you are pregnant, from your fetus inside of you is already aging from the second week. And the health trajectory of a human starts not at birth, but well before birth. So from the health condition of the pre-pregnant couple, they are already influencing their generation to come. And the amazing fact that it is influencing the fetus and the child that is going to develop, but is going to also affect the generation that comes next. So we are already influencing the health of our grandchildren without knowing. And this seems scary, but actually it's a fact very well proven. So we need to reshape the way we look at wellness because we know that our environment shapes who we are. It's a cycle that goes straight from pregnancy, right, Sophie?
Right. Longevity and biohacking and these buzzwords. The reality is that all major chronic disease right now, cancer, Alzheimer's, obesity, heart disease, they're all metabolic diseases. It's based on metabolic dysfunction. So it is lifestyle based. You can biohack all you want. You can do all the peptides and stuff, which is like 99% of the time when I have a new patient, they'll be like, "Ooh, I really want to do this peptide and that peptide." And I'm like, "That's fantastic, Janet, but you haven't had a good night's sleep since 1997 and you're bleeding out of your left eye." So there's other things to address before we are throwing stuff against the wall and see what sticks, right? So it's a lot of the times we really want the next big thing. But the bottom line is if your foundations are cracked, we're just, holding together a failing system with duct tape. So it's really important that we really address those core foundational bits first.
Okay, so usually mental health gets left out of the longevity conversation, so I'm really happy that I'm here. And trajectory is that we're getting older, but we're probably going to end up as geriatric, depressed imbeciles if we don't be careful, right? And one of the things I think that we kind of leave out of the mental health aspect is that we are still in our prehistoric state and we are built as scarcity experts, right? But we're living in such abundance and there are so many tools, and these tools do not have guardrails, and they're impacting our mental health and our cognition and our processing information. So I think on top of regulating your metabolism and looking at how you impact the next generations, it's really important to kind of environment hack which tools we let into our life and in which capacity and how long, and what we expose ourselves to.
This is really interesting. I'm not sure if you heard it well, but it was really interesting. And it's not because I study psychology, but I really think it's a very valid point that we need to think about our mindset and mentality. I was thinking about what you were saying, that we're influencing our, future grandchildren, which is really scary. So I'm actually really happy that I quit drinking this January. Now I think I have to, quit longer than I thought. But anyway.
You can also blame your grandparents.
Yeah, definitely they're there to blame, because the attraction comes from somewhere. And in that sense, and I'm sure many of you have started with any, New Year's purpose. So what about this new habits that we want to enter in our lives in January and hopefully for a long time, and how to tackle these habits and how to not get frustrated with them? So maybe you can give us your perspective, because it's good talking about longevity, but longevity is around behaviors, right?
Can I start with that topic? Because I think it has a lot to do with psychology and motivation, discipline, all these kind of things, right? And we are not necessarily equipped to be disciplined, especially in, if we go to the bar each night, or we, have our mommy dates with the rosé and everything, to be able to say, no, I don't want to eat, I don't want to drink, I want to go to bed early. That's really, really hard. So on top of kind of like breaking your goals up in small steps that are manageable and saying, okay, I'm going to be really self-compassionate, it's really also important about how you shape your environment around you. Like, for example, locking the phone into a box at night at 7, 8 p.m. and really like maybe having a lock on it, because the probability that you'll reach to it is just there, because we are not built to withstand that. But we can hack our environment and make sure that we're not exposed to these things, and that will have an effect on us and which goals we then achieve.
There was a really nice study that was done out of the people who leave the doctor's office. Do you know what's the percentage of people that actually do what the doctor tells them to do? Like, you come 30%? To the doctor and they say, okay, you have high blood sugar, you have high cholesterol, and you need to work out, eat well, go to bed early. Do you know how many percentage of people actually follow this advice? More or less?
5?
Well, not so bad.
30?
So only 30%.
Oh,
yes.
More than I
because
thought.
Changing your behavior, harder than taking a pill. Just give me a pill to sleep and I'll be fine, right? It's easier to go to the pharmacy and buy something than change your behavior.
Yeah.
And again, like you were saying, to change a behavior takes time and you need to be supported with that. Society is not made for you to change your behavior because you want to quit drinking, but every time you go into a bar, there's only drinks or bad drinks that sometimes are worse than drinking. So it's really how we protect ourselves, how we learn how to say no, how we become more mental resilient, and how cool it is to be outside the norm. I'm going to bed at 8 now or at 9. I'm not going to go out and, drink alcohol until midnight. And it's fine. It's fine. We can have our own individuality and then we can enter into many socialistic aspects, whether we want to be in the crowd and feel belonged. But I think this next decade will bring us more awareness to our own being, what is good for us, be more connected, be more simple. And we are here in a conference where we're talking just about tech, but maybe the future will be about being more grounded, more simple.
Yeah. But that's the beauty about AI and healthcare, because in a way, AI can help us be more motivated to achieve our goals, to those little micro steps. But at the same time, it's all tech around us, right? So we are not still in the present moment. How many of us actually enjoy a true moment without any AI or tech around us? How many times we are just sitting still and we just like, oh, let me just check my phone, let me check Instagram, let me check. And even when we are with, as a pediatrician, I have to always go back into parenthood, that when you are with your kids, are you physically present? And this is so important for mental health, right? Being present, actually present, is not just present in the same room, but playing, interacting, getting to know them. It's so important. And in a way, technology is taking us away of that.
I was going to that, and actually I wanted Sofi to tell, because I know you're holistic, but starting with nutrition, and it is one of the first things that they tell you to do when you have a problem or if you want to avoid problems. 2, 3 things would you suggest everyone could do? And then, because I know it's very easy to say avoid sugar, but have you ever tried that, by the way? You can't eat anything.
No, but that being said, you ask someone, okay, you're not supposed to eat sugar, but do you know why? Like, what does it do to you? And so there's a massive disconnect with, your mind, body, and soul. And now we have all these wearables. Like everyone, my continuous glucose monitor and my Apple Watch and my sleep tracker, my Oura Ring, and I'm tracking everything. And so, you wake up, it's like, that's wonderful. And then, I didn't sleep last night. But you didn't know that until you looked, right? So you are not trusting yourself anymore, and there's a disconnect there. So you have to understand your body is all these symptoms you have, these brain fogs or whatever you might think is going on, like, I just don't feel right, my skin tone is a bit off, or I'm limping all of a sudden, all these things. It's your body literally yelling at you, like, look at me, there's a signal. And you're like, it's fine, I'm just gonna keep limping until it goes away, and then you get used to it. And then if you want to change habits, to get back to that, it's honestly know thyself well, try to get to know yourself again, connect again, and do one thing at a time. You can't do 15 things like, I'm going to have a New Year's resolution, I'm going to change entirely by tomorrow. Or like my favorite is, I'm going to do a 3-day fast. I haven't fasted ever in my life. I'm going to do 3 days. Do 4 hours, you know what I mean? It's like all these habits that are changing, you want to change. You have to look at it as like a muscle that you exercise, It's like the stronger you get in your willpower, like the stronger, and have a support system, have a buddy.
And from all the things that happens during aging process, so you lose connection within the cells, your senescent cells, zombie cells circulate around your blood, increase in inflammation, your microbiome disrupted, everything that happens, it's proven scientifically that a way to counteract that or to push that back is through your lifestyle. So if you sleep well, if you eat well, if you manage your stress well, if you are physically active, this is proven scientifically, not me saying, that it's going to have an impact on all the hallmarks of aging. So it's not about talking the best peptides, exosomes, whatever.
You can totally do that.
That's already the third stage.
Later.
You have to start with the foundation.
You have to start with the foundation
Yeah.
and have the basics right. So,
So being practical, because we all want to get out of this panel with homework, right? So from each of your perspective, what are the things that you tell your patients to do in a general basis that probably only 30% end up doing? So starting from children. Yeah, starting with children, what are the main things that you tell
Good
parents?
quality food, homemade food.
Homemade food, okay.
Work on your stress, mental health.
Okay.
Everyone's different, honestly. I've said so many things. But yeah, tune in. Tune into yourself. Like, stop listening to every other device you've got and just like, how are you really feeling? Like, figure that out. Connect this again. You know, and I'm not woo-woo, but it matters. A little bit.
Yeah. I think you can only tune into yourself if you have the time, right? So we need to reclaim our attention and set really crass boundaries about what we expose ourselves to. Get off the social media, put your phone out of the bedrooms, and just manage how you use AI in a way that it challenges you and you don't form an attachment with it, please, I beg you. I think those things, and then you'll be able to have the space to listen to your kids, listen to yourself, understand yourself and, you know, society, and reconnect with other people as well.
Lovely. I'm totally into all of those. I probably only do 30% of it, but I'll get into the rest. So here we're in the iFUTURE Summit. So what about the future? We've talked about the buzzword and we know how important it is. How do you envision the future of healthcare, in the sense that maybe some people here want to invest in healthcare or create their own startup or have kids that want to study medicine, poor kids. So where would you think the future is heading in healthcare from your perspective? Yeah, you can start.
I changed my mind like 5 times, like what? Because this is such a large question. In all honesty, you know, as I talked about all the wearables, like the amount of data that we have in healthcare is enormous. And so we don't need more data. We need something to like interpret that data properly. It's like, you know, it's insane how misinterpreted these are. And people are like, I have the CGM, but I have what does this mean? So I think there needs to be an injected human layer there. It's like we need this person between the AI and the end customer. Because my 80-year-old mother, who needs this more than anything, this kind of, you know, healthcare, is not going to do AI. But if there's an in-between, that's important. And AI is amazing. Like, I'm all for tech, don't get me wrong. But the bottom line is that we are very biological. We are very like very human, and everybody poops. Do you know what I mean? So it's
Speak
like
for yourself.
we need that in between. We need that human component. From the healthcare's perspective, we talk at length about this.
It's interesting because it depends on who you ask that question. As a doctor, if you ask the AI skepticals, they will say, "Oh, they are not going to steal our job. We are going to be still needed. Blah blah blah." There is no room for AI in healthcare, in medicine. But actually, I see it as they are going to help me to unbulk all the things that I don't need to be doing, because we are not just doctors, we are secretaries, we are typers, we are doing so many admin work all the time, that I see that AI is coming to help us. It's going to help us to decode all the labs, compile all in one place, be much easier, much flowing to get the diagnosis right, treatments right, and then we have more time to focus on the patient that is in front of us and the families that we see every day, because you can see that in daily life when you go to the doctor, the care is disfragmented. It's 10 minutes appointment, no one examines you, and they just give you a prescription and a script and go and sort yourself out. And this is not the way medicine should be. And I think AI is going to bring a lot of good things that will help us to construct a much better medicine and a better care, not just in the office, but in homes, in hospitals, digital, and even in, you know, low-income countries where nowadays even it's possible to do a surgery in long distance. So there's a lot of things that are happening, and I think we should embrace AI, but I don't necessarily think they are going to steal my job. I think I will still be a good doctor.
On that note, just to let you know, because it's a very, you know, industry data, but 2/3, Oracle launched a study just, I think, a year and a half ago, where they stated that 2/3 of the time that a doctor spends in the consultation room is dedicated to administrative tasks.
Yes.
So it's amazing. Imagine if we could take those 2/3 into actually caring for patients, how many more patients we could see, and how many much, we could, all these bottlenecks could be suddenly liberated. So really interesting. Apart from AI, I mean, I know we love talking about AI, but yeah, so the future of healthcare, you said there needs to be a bridge in between AI and care and human, right? Mm-hmm. You totally embrace that in operations. What about you two? What do you see like you should focus your time?
Well, as medicine is becoming more preventative, right? At the same time, personalized and also more proactive, in which the patient also has a say in its own health trajectory, right? Because before, if you look at the health appointments 30 years ago, you go to the doctor and he'll say, this is what you have to do, and there's no discussion. If you don't trust me, go to another place. Now, we as doctors also have to rethink the way we approach our clients, not patients, clients now. And we need to discuss with them what the AI I just told them, the ChatGPT notes, and be prepared to lead with the battle of, that believe it is right, and discuss more with our clients. So I'm feeling as a doctor, there, of course, the bureaucracy support AI is going to help us, but also we need automatization of systems that also helps the patient, the client at home, because it's very easy to do it in your office, but then when I'm going home and I have to make my choices, how am I going to do them? I don't know, or I have questions, and then you feel the need to communicate more with your healthcare assistant, and it's not always available for you. It's a big problem because the more information you have, the more things you have to deal with, and there's not room enough for doctors to reply to all your concerns and questions, and they come every time, oh, look at my wearable, this is my heart rate is raising, who am I going to talk to? So I think some kind of project or investment in the technology that also help patients at home, being in geriatric care, in nursing homes, connecting clinics to patients at home, automatizing inputs for behavioral change. Well done, you're doing the right choice. Oh, you just bought these things at the supermarket. Well done, now I changed this for this, or I don't know, some kind of support back home, all kinds of
follow-up monitorization and not just focus on when you're in the clinic.
Yeah.
Right. It's great.
And pattern recognition as well.
And pattern recognition, right. So
we can
gathering the data when you're away as well. Okay.
Yeah.
Yeah, and pattern recognition, I mean, if you try to get a diagnosis from a doctor, that's already hard enough, right? But I tried getting a diagnosis from a psychologist. So we've already seen that AI is a lot better doing prediction and doing diagnosis, and that's really, really helpful. And it is a big equalizer for access to treatment for the ones that are regulated and have gone through testing. There's like 2 or 3 AIs like WISA or ISO or EQ, shout out to myself, that is doing a really good job and is proven to be evidence-based. So I think kind of like making healthcare accessible, prevention for mental health accessible, and showing predictions is going to be really, really helpful. Now the point is, where do we make sure that the client knows if this is a good product to use or not? And I think that needs more education of the general population, and that's a bit worrisome when people are treating themselves with ChatGPT or Grok. So yeah.
Right. Well, I mean, we are finished. Of course, women are very on time. A big clap to us, and if you want to speak to them, they're amazing. Lots of things to talk. Thank you so much.